Hi, thank you for coming back in this fourth video on the OCD and ERP and OCD treatment. Last video we spoke about habituation, and we're going to be working today a bit more on habituation, learning a bit more, and sort of giving a bit of more rationale on how it works and why facing your anxiety may change everything for you. So, as I said, I'm Jaime, and I'm an ERP, CBT, and EMDR therapist, and the founder and director of the online therapy clinic. So let's talk a little bit more about habituation. Habituation is the process of getting used to a situation by staying with it rather than trying to escape or neutralize it, as we saw last week last video from the drawings and the graphs. So to help you visualize it, and I do a lot of visualizations in session for many of the things I work on, I'm going to ask you to imagine you decided to try something difficult, something that you would not have tried before. Bungee jumping. So you book, and I said you bungee jumping as an example. You think about something else, right? Something that is safe and is controlled environment, and you know that the majority of times nothing wrong happens. So let's go with bungee jumping. You book the jump. You're standing, you got there, you are standing, you go up the crane, they lift you up, or if you're in a bridge, you stand in the platform, you have the harness in, you got the straps, everything is checked. And as you're looking down, right, you see the drop. And suddenly the normal anxiety will start increasing, and it hits you. It hits you hard, because that's where you are. You're on the edge of something really dangerous you've never done before, really scary you've never done before. Your heart races, your stomach flips, and you think, no, there's no chance I'm doing this. So you go back up. Once you're back on the solid ground, how are you feeling? Probably, hypothetically, less anxious, right? You may be feeling disappointed to yourself. You may be having thoughts about beating yourself up. You may have a lot of negative thoughts, and the anxiety has dropped because you have removed yourself from that situation. Hence, avoidance works, and hence, in the short term, it does help you. Now, this is an example that maybe we don't need to do, right? So we're putting it in a context of something that is impacting your day-to-day. So things that you're avoiding, things that you are doing, that in the short term, they are helping you. Somehow you know that they're having a big impact in your life. So now let's say you regret backing out, right? And you thought, oh, I really should have done this. I should have done this. So you rebook the jump and return the following week. You're back on the platform, and again, anxiety peaks, you back out, again, your anxiety drops. And you haven't learned anything new. You repeat the same thing. You reinforce the idea that the situation is too scary to face. You repeat the pattern 10 times, climbing up, feeling anxious, backing out. Climbing up, feeling anxious, backing out. Will your anxiety be any lower on the 10th time you do it, or will be the same? Probably it will be the same. Your anxiety hasn't reduced. In fact, it might be even harder to jump. So the more you avoid it, the more you went down and go back, the harder it gets time and time again. And that avoidance has strengthened that fear. So now let's imagine a different choice, a different path. And you'll see me going back again to choice. This is your choice. This is ultimately an invitation, right? And it's not like I'm inviting you, you're inviting yourself, right? So different path, you're back onto the platform, you feel the same urge of anxiety. And this time, you decide to jump. You are certainly, or anyone in that situation will be certainly terrified the first time. And of course, there'll be a lot of thoughts coming. And as you fall, some of the thoughts will increase, anxiety will start. The longer you go down, when you get the first bound, second bound, your anxiety at some point might start fade, might start to fade. By the time you are out of your harness, you're out down, you are okay. So you decide to go again another time. On the same day, go up and go down, go up and go down, go up and go down, and bouncing, bouncing, bouncing. You do 10 times. And also you go then the week after, and the week after that, and 10 weeks. By the time you've done 10 jumps in 10 consecutive weeks, you've done 100 jumps. How do you feel? How do you think you would feel? Probably, and that is from my clinical experience, less anxious than what you felt the first time when you did it. And even maybe bored. Maybe like, yeah, go and jump, get off. You may notice a bit of anxiety, maybe a bit of uncomfortableness, discomfort, yet you'll be like, well, I'm doing it again and I'm doing it again. And the anxiety will not be to the height that it was before. And one of the things is that nothing terrible has happened. You've done it so many times before. You learn that you can also handle the situation. And your window of tolerance has increased, right? We touched on that a few videos ago. So your window of tolerance, what it felt more harder to do, now it feels less harder to do. And that's what we call habituation. When you stay in the situation, when you resist the urge to escape or neutralize those feelings, your anxiety, your discomfort, your physical sensation, they come naturally down. And over time, the more you do it, the less anxious you feel. This is the principle we use in ERP OCD treatment. It's certainly not easy. It's certainly not for everyone. It's for the majority. And I've worked with many people who've told me how painful and uncomfortable it is to sit with those feelings. And I truly empathize with them and I believe them. You will be sitting, if you're listening to this or watching this video, because you are experiencing OCD, you are in the difficult chair, right? What I also know from the years of clinical experience and supervising people is that the approach works. And there is a lot of research out there. And it really works well. And it's not for everyone. And most importantly, not everyone will have the same steps. Everyone will start in a different place and will go at their own pace. So if you've been stuck in a cycle of avoidance or in a cycle of responding, and you want to know whether change is possible, it is. And it's not about being fearless. It's about having the choice and being willing to feel the discomfort, willing to stay with it, and willing to learn that you can survive it. And that's what the choice when you think about your OCD is. Do I want to continue doing the same, or do I want to change what I'm responding to this? Okay. I hope this has helped. It's clarified a bit more about habituation. You know, you can drop a comment. We'll answer and comment back. You can like us, you can subscribe, you can share us. Thank you very much.